Do you have severe menstrual pains each month? Well, you might want to pay attention to this one. Gynecologist and obstetrician Dr. Kiri-an Bridgewater-Lyon joins us now for a discussion surrounding dysmenorrhea and guides us on when it is necessary to seek medical attention. Hey, Doc. Morning, how are you?
Morning, Delia, how are you?
I am good, and it's great to have you.
It's great to be here.
So a lot of persons, I mean, Neville and I were playing around with the pronunciation even. A lot of people may not be familiar with the term dysmenorrhea. Can you tell us a little bit about what it is?
So dysmenorrhea is a condition in which women have very painful periods. A lot of times culturally we think that that's supposed to be a normal part of the burden that a woman bears, but it's actually not. It is a distinct medical condition, it is abnormal, and it's something that can and should be treated.
What's the difference between, because we've spoken about endometriosis on this show as well. So what's the difference between dysmenorrhea and endometriosis, or is dysmenorrhea a feature of endometriosis?
It actually is.
Okay.
So in medicine, we have things called, conditions and symptoms.
Yes.
Dysmenorrhea is a symptom. It's something that a woman experiences. It is the fact that she has painful periods. Now, dysmenorrhea can be caused by different conditions, of which endometriosis is one.
So tell me, what are some of the other things that may trigger it?
So dysmenorrhea can be triggered by hormonal things like increased prostaglandins, which is a hormone that causes inflammation. We're all familiar with inflammation. And then it can also be caused by other structural things. So things like endometriosis, which is where tissue that is very similar to the lining of your uterus is found in other places in your abdomen, sometimes even outside of your abdomen. But particularly for dysmenorrhea, it's because of it being inside of your pelvis or your abdomen. And it causes bleeding and irritation to the lining of your tummy. And that's what causes this severe pain. It can also cause adhesions, or what we call scar tissue, forming inside of your stomach and causing tissue or your organs that should be able to move to not move, and therefore increasing the pain and the dysmenorrhea. It can also be caused by other conditions like fibroids, which we know is very common in our population as well, especially with our Black women. Other conditions that can cause it as well are things like adenomyosis. Now, adenomyosis is almost like endometriosis' cousin, because it's also the tissue from the lining, but instead of being outside of your tummy, but outside of the uterus, inside of your abdomen, it's inside of the muscle of your uterus.
Wow.
And therefore it bleeds into the muscle, irritates the muscle, and causes for severe cramping. And these are some of the most common causes
of it. When should you seek medical attention? Because as you've said, over the years, they've made it seem like it's almost a rite of passage. So they'll say, go take a painkiller. They'll say, get something warm and put on your tummy, or just lie there in pain, it will go away. When should I seek medical attention?
So strictly speaking, if you have dysmenorrhea, you actually should be seeing a doctor, because dysmenorrhea is not your normal, I have a little bit of cramping pain. Dysmenorrhea is moderate to severe pain that's affecting your quality of life. So if you find that you have to take time off from work, you have to take time off from school, you have to be going to the nurse's bay, you have to be taking multiple painkillers to get you through the day, you have dysmenorrhea, and you should be seeing a specialist, really and truly, to get assessed, to find out what the cause of it is, and to get treated to improve your quality of life. And dysmenorrhea is very different from regular menstrual cramps. Menstrual cramps tends to be, very mild, occurring probably just before your period and maybe the first 1 to 2 days of your period. Typically with menstrual cramps, you don't need painkillers, maybe at best like a little Panadol or, Tylenol, that kind of a picture. Dysmenorrhea tends to happen sometimes about 2 weeks before your period. It can last for the entire duration of your period and even thereafter, as well as some of the other features that I mentioned.
Yeah, it's a very important discussion, because there's so many, I'm glad you said girls, because sometimes when our young girls complain about these things, we tend to ignore them, and say, you're a teenager, you're just trying to be difficult, you don't want to go to school. Get up and go to school. Everybody feels pain. But it really is something that needs attention. But if I'm experiencing it, and I go to the OBGYN, are there ways that I can treat it?
Most certainly. So dysmenorrhea can be treated in a wide variety of ways, and how we treat it depends a lot on what's causing it, okay? So we can start with medicine. So we can sometimes use certain specific medications to help target the cause. So especially, as I mentioned, in cases where it's what we call primary dysmenorrhea, where it's prostaglandins or the inflammation that's causing it, we can actually give a class of drugs called NSAIDs, or non-steroidal anti-inflammatories. They're really anti-inflammatory painkillers. So you're very commonly things like Cataflam, Voltaren or over-the-counter ibuprofen. And these kind of painkillers are targeted towards stopping inflammation and helping with your pain. We can also use other medications that are hormonal. So sometimes we may use things like the contraceptive pill to help to improve on person's pain. Sometimes we may use injectable medications. Sometimes people use like what they call Depo-Provera, the family planning injection can be used to improve person's pain. And you can even use things like IUDs or intrauterine devices, such as like Mirena, etc., to help with painful periods. And then also there's also targeting, well, that's symptom treatment. And then there's targeting the underlying condition. So depending on what it is, if it's fibroids, it may require, you know, things like surgery. It may require things like lifestyle modifications, changing your diet, changing your level of exercise or activity. If it's endometriosis, again, it's inflammation, so changing your diet can have significant implications in terms of improvement in their condition, lifestyle changes, potential surgery as well. And so we kind of treat it on one, treating your symptoms to improve your day-to-day, and then two, treating the condition so that we can maintain you thereafter.
Yeah, it's a conversation I've had with people in schools where I've said, I mean, you know, we go in with the PE. I don't know if we do as much. We do it in primary school. Once we get to high school, when girls get to fourth form, fifth form, they kind of, you know, oh, we don't want to do PE.
Certainly. I don't want to sweat. I don't want to do this.
Yeah, and I've said to them, maybe we should introduce things in school like yoga or other types of exercise, because when you, as you've said, diet, exercise helps things like this in a young girl.
Honestly, Delia, diet and exercise is the foundation of improving a lot of our conditions, whether it be non-communicable diseases like diabetes, hypertension, gynecological conditions like dysmenorrhea. What we eat impacts our body so much. What we do with our body impacts how it functions. And I think we definitely underestimate how vast of an improvement your life and your quality of life can be when you keep active and when you're careful about what you're putting into the body.
Yeah. You're an OBGYN. I like to ask the question, at what age should girls and women start seeing an OBGYN? So
you should actually see a gynecologist as soon as you are in the pubertal age. So especially, I typically tell persons around 15, you should really see by 15, you should have seen a gynecologist. Some girls start menstruating even earlier than that, right? And so really once you start menstruating, you should have a touch basis with a gynecologist. One, to build rapport, because I think part of the problem culturally is that women feel like going to the gynecologist is something they should be afraid of or even ashamed of. You think, oh, you only go to the gyne if you have a problem. Somebody said, oh, I have to go to my gyne. They said, so what's wrong with you today? That shouldn't be the culture. Going to the gynecologist is something that you should be doing on a regular basis for upkeep and maintenance, just like how you do upkeep and maintenance on your vehicle, right? Also, because we might be able to pick up on things that you don't know are abnormal. So exactly something as simple as painful periods. Many women are out there suffering with painful periods, thinking that this is a norm and this is just, I just saw it go, you know? But if you come to the doctor and describe your symptoms, they'll be able to say to you, no, that's not the way it should be. Let's work on this. Let's improve your quality. And as a result, this person can now use their, you know, be more functional at work, be more functional at school, be more functional in life.
And also be able to track their cycle, because if you track your cycle, your gynecologist can help you to identify patterns.
Most certainly, and the patterns mean something.
Patterns mean something. All right, so I'm glad we're having it. Not just the ladies, the men too. It's important that you understand this, because emotional factors are also symptomatic of dysmenorrhea. Well, if you're in pain.
Certainly.
Yeah.
Certainly.
Yeah.
So think about it. This is pain that somebody's experiencing associated with their periods. Your period should be coming every month. If for persons who are having their period every month, that is, you're having pain every month. That is a chronic painful condition. Most of us, if we have pain on a one-off, we're already in a bad mood about it. If you know you are watching the days count down, you're coming on, you know this pain is coming, there's nothing you feel you can do about it, that's now going to have psychological impact. You're going to feel hopeless. You're going to feel despondent. You're going to feel frustrated. And that's going to come out in other areas of your life, how you interact with others, with your significant other, with the persons at your workplace, especially if you don't feel like your symptoms are being understood and validated. And so it can manifest in interpersonal issues. It can manifest as depression. It can manifest as anxiety coming up to the time of your period. And it has far-reaching implications, not just physically, but psychologically. And so I implore all women who are experiencing any kind of moderate to severe pain associated with their periods, please go and seek medical attention. There are things that can be done.
Yeah. And I know we like to culturally ignore things. You know, there are some parents out there now say, Lord Jesus, me go through it when me a pick me, it never kill me.
Yep.
Because you went through it doesn't mean your child has to go through it.
Agreed.
So please, I'm begging you, ladies, there are some things we do have to do in 2024. And dysmenorrhea is one of them. Thank you so much.
Thank you so much for having me, Delia.
Gynecologist and obstetrician, Dr. Kiri-an Bridgewater-Lyon. That's 10 minutes to your health. We'll do it again next Thursday.